Destination Medicine is a collaborative initiative of regional training hubs. With first-hand lessons learnt from those who have gone before, this podcast is designed to assist and inspire anyone interested in pursuing a medical career in rural and regional Australia. Welcome to Destination Medicine. I'm Peter Letts. A country boy who trained at UNSW, Dr. Marty Ryan has certainly landed in his happy place. After spending his last 2 student years as a junior doctor at Wagga Wagga Base Hospital, he's now working as a trainee GP in the riverina town of Temora. Dr. Ryan says that not only is he getting outstanding training and professional support, but his private life is similarly supported by Temora's inclusive community. He's so at home, he now says Wagga's traffic is too congested for his tastes. Dr. Marty Ryan starts by describing how he has developed his skills to Nicole Goodman.
For the past few years, I've been completing my junior doctor years of training. So basically, I graduated from UNSW, did my last couple of years in a large regional town in New South Wales called Wagga Wagga. And I stuck around in Wagga Wagga to complete my internship and my residency years at Wagga Wagga Base Hospital. After that, in my third year postgraduate, I then started training in what's known as rural generalism, where basically it's rural general practice, but you have some other special skills on top of that as well. And in my third year postgraduate, I decided to pursue some emergency medicine skills training. And so I spent the whole year at Wagga Wagga Base Hospital in the emergency department there, getting up those special skills to prepare me for working in peripheral rural town general practice, because in those towns you need to look after the emergency departments there in their little district hospitals. So that's what I did for the year. And then this year, I've just started in a small country town called Temora, which is about an hour north of Wagga Wagga, about 4,500 people. And yeah, I'm finally doing exactly what I want to be doing in the longer term, which is general practice in a small country town. That brings up to speed with what I've been doing.
That's fantastic. You grew up in Cootamundra. How do you think that your upbringing has influenced your career path?
Yeah, that's exactly right, Nicole. So I grew up in a little town called Cootamundra on a farm there, and there were lots of things about my upbringing that influenced me along this pathway towards rural medicine. So going to school in Coota, playing sport in Coota, being involved in music in Coota, all of these things allowed me to recognise how ideal small rural towns are for living in. There's multiple reasons for this. There's, of course, the lack of traffic. There's the relaxed lifestyle. It's easy to get around. There's lots of absolutely hilarious characters who reside in country towns who you come to know. But above all, I do have to say that the sense of community spirit in small country towns like Cootamundra is what makes them best of all. And again, what influenced me towards wanting to practice medicine in the longer term. This sense of community spirit, it shines through in the bad times. For example, in Coota, when I was growing up, the bushfires that everyone banded together to get through. For example, even just recently, one of my former school teachers took his life, and coming back for the funeral, the entire town was there basically forming a guard of honour for him, and it acted as a real community opportunity for people to again get together and become stronger. And also the good times. So again, charity fundraising concerts that I've seen over the years in Cootamundra, sporting grand finals that Cootamundra has won, where everyone just really comes together. It's these sorts of experiences that you realise that you want to be part of and living in a place where you can experience them in the longer term. The other reasons that I wanted to go into medicine, growing up on the farm, I was pushed away a little bit from it, given that I grew up through the millennium drought, and also my parents, they recognised I was quite academic at school, so they wanted me to pursue something else. But also, personally, I did want to pursue something in science, which could satisfy those interests. It was even better that I could try and pursue something that would be helpful in the day-to-day life of others. And so all of these things, my own interests, being able to make a difference and set up a lifestyle in a rural town, it all made sense that I wanted to do rural general practice.
And so how did working in Wagga fit into your life plan then?
The reason that I stuck around in Wagga is because I wanted to stick around in the region at large for the longer term. And being a medical student in Wagga and then doing my first few years of junior work in Wagga, made sense for me to be able to learn all of the referral pathways that are unique to the Murrumbidgee Local Health District, in which Wagga's a part, and the towns where I want to be working were part of as well. But also to be able to come to know the consultant specialists working at Wagga, whom I would be referring to in the longer term when working in peripheral town rural general practice, so that they could know who I was and, trust who they were talking to over the blower whenever I'd have to be doing so in the longer term. They were the reasons why, I stuck around in Wagga.
And what have been the highlights of your junior doctor training in Wagga?
My time as a junior in Wagga, there were lots of highlights. For me, the biggest ones were the times when I was treating complex patients, I suppose. Multi-issued patients who, you felt like you were being able to achieve a lot of difference in their lives, because a lot of the time you were the only one who could make this difference when you were working in a busy team. And some of the other highlights were when patients were complimenting the service that they'd been given, especially when they'd tell you that, you'd restored their faith in the medical system as well. That happened time to time. All of my amazing colleagues that I worked with, not only doctors, but all of the allied health, all of the nursing. It's a brilliant hospital and I had a great time whilst working there.
So what was it like being the most junior member of such a busy team?
It was a very interesting experience, but when you're the intern on a busy team and your consultant boss and the registrar are caught up in theatres all day, for example, as the intern on that team, you actually have a very large power to make a big difference in the lives of your patients. Because if you're not doing anything, then no one's going to do anything because of how busy the rest of the team is. And for example, I can think of one patient who was a schizophrenic, diabetic man with heart failure who was in my very first term as an intern on a busy team where, again, everyone was caught up in theatres all day. Now, I was able to sit down and figure out all of his issues, seek all the appropriate referrals for the different various problems that he had, and help instigate changes to optimise his health before his hospital discharge. And then, extend that process to communicating with the GP once we're about to discharge him and set him up for care in the outpatient setting as well to continue his health optimisation. So it's those sorts of times where, being the most junior member of a busy team, you could still make a big difference. And again, when you recognise these differences you're making, I found it was very fulfilling for the soul. And that's another thing that I really like about GP, these multi-issued complex patients that you can make a lot of difference for.
Of course, junior doctoring has its own challenges. What are some of the challenges you faced and how did you manage them?
So the biggest challenges for me, I can think of some very, very completely busy shifts that were very crazy, where especially, night shifts where you're looking after pretty much the entire hospital and you feel like you're just running across the hospital department floor all shift and the workload is so much, like you just feel like you're getting nowhere the whole shift. So those I found were the biggest challenges for me because of how busy they were and because of how lost you could get in all the work you were doing. However, even though these were challenging, these were the shifts I found that made me a better doctor, actually, where you actually truly learn to be efficient. You manage to recognise what actually matters clinically. And I can think of, myself before these types of shifts and think of myself after these challenging shifts, and I just transformed as a completely different doctor as a result of those couple of years as a junior. But thankfully, those aren't the majority of the shift experiences I had. They're only the minority, I would have to say. And I always look back on those in retrospect fondly, especially when you're able to bond with your team and others over such busy shifts.
What about the most positive aspects of the process? What were they for you?
I suppose the biggest positives came from, there's times where I felt like I was truly making a difference in the complex patients who I was telling you about before, and being able to work alongside the colleagues that you managed to get through medical school with and you're bonded with, and they were your best mates in that respect beforehand, and seeing, how much everyone else was struggling as well, but you were able to get through and, yeah.
Marty, do you have any advice for someone else about to undertake junior doctoring?
Yeah, certainly, Nicole. I would have to say that it's probably a fairly stereotypical answer, but nonetheless, you can't lose sight of living a balanced lifestyle. No matter how many hours you have to do junior doctoring, Do not lose sight of that. And it's really important to be engaged in extracurricular activities that provide some level of sanity and to be able to meet other people too, especially people outside of medicine. And I've found that in my time over the last few years, sports are the best way of meeting people and having fun in rural areas because, that's what brings people together in rural towns is sport a lot of the time. So for myself, cycling was actually the big thing that I did in my spare time the last few years.
Well, as you say, you're into cycling. What is it about bunch rides that you like so much?
Yeah, so very much was into cycling when I was over in Wagga. It's a fantastic sport. It's super healthy, very social. It's a constant adrenaline rush when you're thrashing yourself in a bunch ride or racing. In terms of bunch rides, they're basically the perfect balance of being able to ride with your mates, of thrashing yourself and also having fun, which, those two things don't have to be mutually exclusive. And you get the coffee afterwards as well with your lycra-clad mates. Debriefing, with them, it's the perfect start to the day. And I was really blessed over in Wagga Wagga that they had a fantastic cycling scene with lots and lots of different bunch rides of various abilities. And I love that aspect of when I was in Wagga.
So tell us about Wagga itself and what you really like about the city.
So whilst I was living in Wagga, I found it was a great regional centre to live in. It had all the shopping and services you could ever possibly need, really. It had every sport under the sun. It was still very easy to get around places as opposed to living in a big city, like a big capital city. It had awesome leisure facilities as well, like paintball. It had 10-pin bowling. There was a cinema there as well. I mean, the best part of it, obviously, was the variety of pubs, bars and clubs that were there as well. And I mean, working at Wagga Base Hospital itself was fantastic. Beautiful new hospital, consultant specialists who were excellent to communicate with and took a real interest in their juniors, and an extremely supportive junior doctor department. But I suppose, although it was fantastic to live in Wagga, it wasn't quite for me in the longer term because even that small amount of traffic, it's not for me. And that's why I wanted to move out again to a small rural town where you can have an even better lifestyle and experience, I feel. And that's where I feel I could make more of a difference in a peripheral town than I can working in a big place like Wagga.
So, Marty, where do you see yourself in 5 to 10 years then?
Yeah, so for me, by that time, ideally, I would have finished my training as a rural GP. And ideally, I would have selected a town here in the Murrumbidgee somewhere that, I've set myself up in and established myself for the longer term. And I'll be living that humble lifestyle as the local GP forevermore in that town if it's the right fit. And that's basically what I want to do.
And you're quite involved with the New South Wales Rural Doctors Association. Could you tell us a bit about that organisation and why you are so involved?
Yeah, so the Rural Doctors Association of New South Wales, it seeks to maintain and expand New South Wales rural medical workforce primarily by addressing key industrial issues. However, there's also advocating for rights and needs of its members and by seeking out solutions to rural workforce shortage. It's basically how they work. It's very important to try and make work and contract conditions as optimal as possible to attract as many rural GPs as we can. So that's a big reason why I'm involved. Without boring you, one of the big things we've actually managed to achieve recently is getting equal pay for rural junior doctors when they rotate to the city to learn new skills, to bring them into line with increased pay that the city doctors get when they come out rural. So that was really exciting.
Marty, have you found any good mentors to help you along the journey?
Yeah, most certainly. I've been really blessed to have lots of mentors in my journey over the last couple of years. There's been Hetty, which is the Health Education and Training Institute of New South Wales, who runs the Rural Generalist Training program that I'm on currently. They've provided lots of mentors who've helped me make some very important decisions and tough ones that I couldn't have done without them. They've given lots of resources. They've also given monetary support as well. ACRM, who's the Australian College of Rural and Remote Medicine, again, they've been extremely supportive with lots of different personnel in a ladder to help me with everything in my training, giving resources. There's been study groups as well to help with exams. The Murrumbidgee Local Health District has been very helpful as well. There's a specific pathway that I'm on, again, for rural generalist training in the Murrumbidgee, which they provide mentors as well. There's been GP synergy in previous years as well, who have provided GP training. All the medical admin at Wagga Base Hospital is so supportive for junior doctor wellbeing, and I've really appreciated everything that they've done as well. Working in Wagga Base Hospital emergency department last year for the whole year, all of my mentors there, all the bosses, all of the staff on the floor, everyone was just so helpful. My current GP supervisor at my job here in Temora, Dr. Rachel, the famous Dr. Rachel Christmas, again, she has been extremely supportive as I've started off here.
Can you go into any more detail about how these people and organisations have been able to assist you on the journey?
Yeah, okay, yep. So, for example, with Hetty, I wasn't really sure where I wanted to go in the longer term with my training as a GP, and I didn't really know hugely well what skills I wanted to pursue as well. I was talking before about those advanced skill training, and I didn't really know much about the training itself and what it looked like. And Hetty, they had mentors who in the first couple of years of being a junior doctor, they were able to supply me to have a chat and make some recommendations on what they thought I should be doing, and basically educating me on all these processes, which was extremely helpful. And I was able to decide to come to Temora here this year ultimately, and also decide on doing my year in emergency skills last year as well, which was very, very vital, I feel, in the longer term.
Well, as you've just mentioned, you've started working in Temora on your first placement as a trainee rural GP. How has the experience been so far?
It's been fantastic so far, Nicole. It's been everything that I thought it was going to be. So basically the way that the term is structured, or my placement here is structured, is during the day, I'm at the GP clinic here in town, Temora Medical Complex, and I see all of the patients during the day just like any GP would. But then also one day per week, I'm on call at the local hospital. I see everything that comes through emergency there, and anything that I need to admit at the hospital, I basically look after them as an inpatient for the duration of their stay in hospital. So again, there is a wide variety of cases and experience that you get, and I've seen lots of interesting cases so far. I've seen one guy come in for a work cover check, and I recognised that he was having a bipolar manic episode and had to refer him over to Wagga Base Psychiatry. I've seen one of the biggest abscesses I've ever seen, but also there's been longitudinal care as well. I've been working on diabetes with patients, COPD, and what's really fulfilling is patients telling you that they're making the changes that you've recommended.
I have to say it sounds really exciting and varied, Marty. It sounds fantastic. How then have you found living in the town of Temora itself?
So the town itself has been so welcoming. Temora is known as the friendliest town in Australia, which everyone kept telling me as I came here, and I can certainly recognise that that certainly is the case. I've been involved with, there's a running club here in Temora, which I started going to, and, I'm a bit shy and whatnot, but everyone was just so welcoming when I came there. I've just started with the local rugby club as well, and again, first training session I rock up to, everyone's just so welcoming, going for beers afterwards. They're just so happy to have you here in the town. So I'm loving it, and, maybe I can see myself here in the longer term.
Dr. Marty Ryan, a GP trainee in Temora, New South Wales. This is Destination Medicine. Thanks for listening. Regional training hubs are supported by funding from the Australian Government under the Rural Health Multidisciplinary Training Program.